Hi. Over the past few days, there have been a number of critical questions and accusations levelled at both myself and the Borough Council in relation to the restrictions that were imposed by central government last week. I thought it was important to take the opportunity to tackle some of those difficult questions head on, so you knew exactly where we came from, how we got here, and more importantly, what we intend to do to get out of this. Let's look at question 1. So what's important here is to remember that we didn't ask for all of these restrictions. Last Monday, the government, via Public Health England, informed us that Hartlepool was likely to have restrictions imposed on us by central government that week because they had realised our cases had continued to rise despite all of our best efforts. What they suggested at that point was to work with them to try and bring in a package of support and restrictions that would work best for us. And we felt that that was the right thing to do. It was better to sit around the table with Public Health England and the government to make sure that any restriction that was put in place was right for Hartlepool and that we were happy with. And that's what we did at the start of last week. And that's why we were so annoyed on Thursday and Friday when it was announced that the much tighter restrictions were going to be imposed that went far beyond what we asked for. As I said, just answering the last question there, this would have happened anyway. Central government keeping a very close eye on the figures for all of the towns and the cities across all of the UK. They were the ones who reached out to us last Monday and said that they'd noticed our figures were continuing to rise, and that this isn't just being tracked at a local level. Government ministers, Public Health England and the Joint Biosecurity Centre, they know how many infections have been registered within a certain area. They know everything we know and more. So it's not the case that if we hadn't stuck our head above the parapet, they wouldn't have noticed us, because quite honestly, they would have. I think this has been one of the most frustrating ones that has been thrown at us over the past couple of days. This isn't true at all. As I've already explained, this was coming. A couple of weeks ago, when restrictions were imposed on the other northern towns and cities within the northeast, we resisted going in at that point because we wanted, and indeed I said in one of these videos, that it was really important people were given the opportunity to try and bring those rising infections under control ourselves, and to keep our economy ticking over, to keep going out and meeting friends and family in secure and safe settings. That was really important, and I still feel that that is important now. This was never ever about the money. And I know people out there are thinking that Hartlepool Borough Council are getting £7 million out of this. No, we're not. We are not at all. If you listen to what the Secretary of State said, he said that there was £7 million to be distributed between the 9 local authorities that he mentioned that day. As that will work out, it'll be distributed on a per population basis. So a small town like Hartlepool will end up getting peanuts. And this is, and even if we were getting significant sums of money, it would never be able to be used for plugging budget deficits or anything else. It can only be used for stepping up the likes of the support hub that will need to reopen. There'll be additional enforcement and recruitment for environmental health officers. That's the only thing any additional money will be used for. And as I said, we're already firmly of the opinion that we'll get very, very small amount from the money from central government. Yes, we can prove that around 80% of the cases were being transmitted through household-to-household contact and household visiting. And we're able to do that because of the NHS Test and Trace service. We get that information sent through from the NHS and Public Health England on a regular basis. We are working with Public Health England at the moment because the data technically belongs to them and the NHS. So we're asking if we can release that. But what it shows is whenever there is a positive test, and then the track and trace service goes out and speaks to those people and who they've been in contact with. Around 70% nationally are being caused in this way, and about 80% at the time when we made that claim last week were being caused in Hartlepool, and through, as I say, household-to-household contact and household visiting. This is a really important one. The reason we sat around the table with government last week is because we did not want this to affect local businesses. They've already gone through enough hardship during this year. We did not want to add to it, and that's why we engaged with the government and why we strongly argued against any of this type of restriction being put in place. Now, we're trying to rejig some budgets here within the Borough Council to see if there's something we can repurpose to assist our local businesses. Any of the money, if we get money from central government, from the 7 million that was announced by the Secretary of State, unfortunately that will only be ring-fenced for stepping up the likes of the support hub and other services. So what we have been clearly saying to the government since last week is, if you're not going to change this restriction, you're not going to lift this particular restriction, then you need to fund it. You need to help these businesses out, and you need to help save jobs and keep viable businesses afloat. We've put in multiple requests to speak to ministers to see if we can get this done, and we're doing everything we possibly can to make that happen. Ultimately, we hope to be able to do something as a local authority. But what's important here is we didn't impose this restriction, so I don't think, and I'm pretty sure I'm supported by a lot of my colleagues in this, is government shouldn't be let off the hook. They're the ones causing the hurt to businesses this way, and so they should be the ones helping them out. We'll do everything we possibly can, but government need to step up to the plate and help these guys out. Now, as we move on from this, as I said, we're talking to government trying to get funding through to help our businesses, but what we need from them and what we haven't got yet is a clear exit strategy. We need to know so we can tell you guys how and when we get out of these restrictions. We did not want to go into this with no exit strategy because we needed to know how and at what measure we would be able to return to some form of normality. Unfortunately, the government aren't being very forthcoming in sharing that right now, and so we'll continue to put on pressure and we'll continue to ask because it's really important. We need to have light at the end of the tunnel. You need to be able to know when you're going to be able to see your family and friends again in normal circumstances. My sincere wish is if we all kind of buckle up now and we follow these restrictions as much as possible, that we can bring that rate of infection down, we can bring cases down, and I sincerely hope we can return to some form of normality in time for Christmas. I want that, and I'm sure you do too. Thank you.